It's okay. You can sit with it.
People who prepare government books of accounts. We are the people who audit government books of accounts, including in the hospital. Even here, there are some members of us over here. So these are an umbrella branches. We are about 60 in number. You are asking about ladies. We have ladies there, they are about 5. The profession is a bit difficult one. That's why you see that of you there are few. But they are there. Some of them are just busy. They have to send apology. So this team here, we are based, most of us are based in Kampala, some are in Lira here. So in our AGM, we thought this particular period of Lent is almost ending. Now we are going to this Holy Week. We thought we could come and share some little resources which God has given us in our own capacity. We collected some money, said let's go and visit the needy people, and we selected Children's Ward for Lira Referral Hospital. We made an advanced team here, headed by a team, came and inquire about the population of the children who are here. We were told about 90. So we have prepared something for them, according to the guidance that was given by Dr. Aliana. So we are here to present those little things so that they can share. They can have also a small smile during this Easter season. So that's why we are here. My name is Patrick Uruk. I'm an Assistant Commissioner, Internal Audit, the Ministry of Finance, Planning and Economic Development. I'm the chairperson of this network, Lango, CPA Lango Regional Members Network. So we are grateful for the open heart you have given us, welcoming us here, and also sparing your time to receive us. We are very grateful for that. Thank you so much. That's why we are here.
What have you brought?
The guidance by the management. We have brought pampers, we have brought soaps, we have brought sugar, we have brought biscuits. That's what we are guided to have here. And you will guide us, because I thought the pampers, we have told the pampers we hand it over to you. We're not going to give it directly. But the rest, if you could be allowed, you also see these children, how they are, maybe talk to their mothers, and then we hand over these things to them. So that you can guide us for that, doctor. That's why we are here.
CPA Uganda, and I've also been a friend of this hospital for a long time. One time, several years ago, we had a terrible problem of what is this disease which meningitis. And at that time, the government was failing to help Lango. It was covering many parts of Uganda. Where I was working, we donated over 40,000 lives for covering Utuhe and most of Lango. Then we removed many justice from here. When Dr. Chero was here, we also donated a lot of drugs for this hospital.
You tell us by the time you were working as a CEO of what?
That's when I was in the. Well, I was working at that time with Christian Children's Fund.
Yeah.
I've also been continuously, if things don't go very well here, you always see me around pushing. I was telling there were no rollers here, and I kept on putting pressure that rollers must be given to the hospital and do where the rollers go. It was a bit of a headache, but finally I think it is being done. So I'm always a friend of the hospital. I'm happy to be back again.
Much for choosing Lira Hospital to come and express the hands of love, especially with the pediatric department. We appreciate. We've heard from you. I think it's also important that you get to know a few teams in the pediatric department available at the moment. My name is Jimmy, Dr. Jimmy Alan, part of the team of this department. I serve here as a medical officer. And I think Carol and sister.
I'm a senior medical clinical officer. I'm right in this department in a particular unit called the Mental Intensive Care Unit.
Good morning once again. I'm grateful to have you within our premises. I'm called Sister Grace Amoy. I work in this unit. Currently, I'm wearing the shoes of an in charge. You're welcome.
So the department is divided into three. We have the main pediatric ward where we are, and then neonatal intensive care unit, a bit distance away, but we also get a chance to move there. And then therapeutic feeding center, malnutrition ward, or nutrition ward, whatever we can call them. So I think you will have opportunity to meet the mothers and the children of ward. That opportunity is granted. Yeah, I hope these deliberations will be appreciated by the parents and the caregivers on ward and the community. And thank you for giving back to people. I appreciate it. Thank you.
So, Doctor, we have 90 in number, as you are guided that we give all the 2 wards. So I don't know if the number here may be 50. I don't know if it is possible. You can give us some people to come and we give out this one. Then again, if your time allows, we go to the other wards as well.
It's okay.
Yeah. So if these are senior and chairman, you can hand over to doctor.
Who was requesting?
Okay, Doctor, on behalf of CPA Network here, we hand this over for the support of the children.
Thank you, the team from the Certified Public Accountant Uganda, Lango Members Network. We appreciate, thank you for choosing this Easter season to share your love with the children and the caregivers in pediatric ward, Lira Regional Referral Hospital. The hands offered and extended, especially the shop, the sugar, the pampers, they're helpful to our mothers because these are the things they use on daily basis wherever they are in the hospital. They need the shop to wash the small clothing that they have. They need the sugars to help them prepare tea, and it's important. So we appreciate, we hope that part of this social corporate responsibility extended to the hospital and to the caregivers continues over time. And this is part of giving back to the community as a hospital and as a department. We thank you and appreciate you and ask that God bless you over in this Easter season. Thank you very much.
Thank you, Doctor. Do mấy miếng mì vô mình nhớ ba mì một cái con.
NICU staff and management, I take this opportunity to appreciate the CPA group who has donated to our patients sugar, washing soap, pampers, and biscuits. We are really grateful. May the Almighty God bless you and bless the pockets that have given, and never to lack anything in that pocket. Continue with the same spirit. May the Lord bless you. Okay, some of the challenges we face: one, we lack also soap for washing babies' clothes. We need pampers, but some of our attendants, mothers, are so poor that they cannot afford pampers, and for that we are very grateful. As you are seeing, we don't have any shelters, we don't have even changing uniform for the mothers. So those are the things that we lack. And some have been also staying hungry. As you see, they are having they have not taken tea, but now the sugar will also help them to give them strength to continue with their work.
I'm called Patrick Oruk, an Assistant Commissioner, Internal Audit, Ministry of Finance, Planning and Economic Development. I'm the chairperson of CPA, Certified Public Accountants of Uganda, Lango Regional Members Network. We are here today in Lira Referral Hospital. We have visited the children's ward. Our aim today is to come and share our little part of corporate social responsibility that CPA Lango Regional Members Network thought they could come and give back to the community. In our last AGM of 7th March 2026, members agreed to pull their resources together and come and share the little they can offer to our children who are sick in the hospital. So far, we have been so much welcomed by the management of the hospital. We have been here for almost 1.5 hours. They have given us opportunity to visit the wards, talk to the mothers of the sick children, and we have given them pampers. We have given them soaps, washing soaps. We have given them biscuits, and we have given them sugar. As our little appreciation to what God has given us. As we have said, we are members of Certified Public Accountant of Uganda. The staff, the people who write books of accounts for the government and then for the private sector of Uganda, and give financial advices, taxes, and whatever form business, planning, and many others. I'm very grateful for the opportunity we have been given today. I would like to thank members of this association, of this network, sacrifice and the offer they have given for this cause. I think it has been successful. We thank God for this. We thank everybody that has given a hand to this noble cause for God and my country.
My name is Okelo John Baptist. I'm a retired accountant, CPA and ACCA, but I'm not tired. I continue to support worthy cause, and I'm very happy that my colleagues in CPA Uganda have come together. We've come together to support the young children and their mothers who are in Lira Regional Hospital. But for me, I'm a friend of Lira Regional Hospital, and for many years I've worked together with this hospital. at one stage when meningitis was a big problem in Lango region. While I was working with Christian Children's Fund as their deputy director, we brought support of over 40,000 vials of meningitis to vaccinate, and we got rid of meningitis in Lango here. While Dr. Ochero was in charge of this hospital and I was still with CCF, we donated drugs to support the hospital. Recently, I was working with other people as well to see that the hospital have got rollers and that the authorities work on the walkway so that it is easy to get patients to the various wards. I want to tell the public that today I'm very pleased to see that the walkways are being constructed and a lot of improvement has been done in the hospital. My congratulations to the management and everybody who is working to ensure that patients receive great care in this hospital. I continue to be a friend of Lira Regional Hospital, and I ask everybody to give them a hand to support the very many patients we have in this hospital. Today, we were supporting the young ones and their mothers. God bless everyone. It is even more important because during Lent is a period where we forgive each other and make sacrifice to support those in need. And the church has been on this issue for many years, and today, as we support the needy children and their mothers and their fathers, because we saw one father taking care of what do you call this, the bone which is premature. There was a father taking care. So even the fathers, we want to thank God to give us this opportunity to serve these children with their parents. Thank you.
We are grateful that we have managed to support over 90 children. Some are in critical condition, which needs really help. We are grateful for this opportunity. And it's our hope and pleasure that in future, we are not going to stop here. We are going to support the needy. It's part of our corporate social responsibility. Thank you so much.